Appreciate that. Well, we've been reporting on the news of a couple of well-known people, big celebrities, Kate Spade and also Anthony Bourdain, who took their lives last week. And, it really got a lot of people talking about the very serious issue of suicide and maybe some warning signs that all of us need to be looking for, or if you're someone who feels like you're at that point where you just don't see hope. Well, this morning we're having a very important conversation with two very lovely and very well-versed professionals who know a little bit about maybe, what you need to know, what you need to keep in mind in terms of coming out on the other side of this. And to my far left, we have Kristine Yumul and also Lanecha Williams, and they are from the Well Care Group. Thank you, ladies, for being here.
Thank you.
Just a really important conversation, very timely one at that as well. So, anytime you're processing something like this, Lanecha, let's start with you. I think if you're not in the situation and you're looking in, you're just like, what brings someone to that point where they just feel like they don't have hope, And then if you're seeing some of these signs, first of all, let's back up. What are some of the changes that we may need to look for if, you feel someone may be getting too close to that point of possibly taking their lives?
So some of the warning signs that you want to look for is if a person is isolating, they're feeling withdrawn.
Sure.
Their sleeping patterns might alter. They may sleep less, sleep more.
Right.
There may be an increase in substance use.
Right.
Oftentimes, individuals will actually verbalize and they'll articulate that they are feeling hopeless. They don't want to be here anymore. They want to end it all.
So pay attention to that.
Yes.
In one conversation that was really interesting when I was watching one of the colleagues of Anthony Bourdain, who was saying, it kind of took them as a shock. But, a lot of times in these situations, we kind of want to give people their space. We don't want to feel like, we're stepping on their toes. But is it appropriate if you feel like someone may be getting to that point by just simply asking them, are you to that point where you feel like you may be thinking about something more serious, possibly taking your life? Is it okay to just take that step and not be afraid of stepping on someone's toes?
It is. It's very appropriate. And I always say, err on the side of caution. Be direct.
Okay.
You want to make sure you assess their risk for suicide, their intent.
Right.
And if they have a plan, you want to make sure that we do that as well. We often say, hey, I'll give them their space. I'll let them just be. But oftentimes they want us to check on them.
They want someone to intervene. That's a really interesting point. Kristine, let's talk a little bit on the other side of it. If you are that person, and maybe you never know, someone may be watching right now, what are your words to them? What do you need them to be thinking in terms of, this can lift and there is, hope on the other side?
That you could always just tell them that there is help out there, that you should look for help and that it's normal. Mental health isn't a stigma, that people suffer through a lot of things and that to get help is okay.
Yeah. It's you're not less than, if you're reaching out for someone to help you because you can't see your way through it.
Yeah, it's very courageous to actually go and take that leap to get help.
Yeah, that's a really good point. Let's talk about some of the resources that are available. And you guys know a lot about that, so let's talk a little bit about that.
We do as well. So at the Well Care Group, we offer individual group therapy. We also offer IOP, which is intensive outpatient, and CDIOP, which is chemical dependency intensive outpatient for individuals suffering from substance use disorder.
Because there are a lot of different factors that come into play when you're talking about, a very serious issue like this. This is really important information. We're so glad that you ladies are here to pass some of this along and continue the conversation. And if you feel like you need help, there's a National Suicide Prevention Lifeline, 1-800-273-TALK. And I think the important thing to remember is we need to talk about this. And we can't stop talking about this because it's ultimately about saving lives. Thank you, ladies, so much.
You're welcome.
Appreciate the work you're doing, too, to help people in our community. And you stay with us. We'll be right back on the other side of